Hello, doctor.
Hi. As per modern medicine, diseases like breast cancer and brain tumor need surgical interventions and certain sessions of chemotherapy. If that's the best option available, then why should someone come to you for treatment of breast cancer or a brain tumor?
If we are talking about brain tumor, only 7 days is enough for reducing 1 to 1.5 centimeters. If the patient have 3 or 3.5 or 4, the tumor size is like that. If there is no complication, there is the reduction of tumor size will be 1.5 to 1 to 1.52, that, like that, depend on the patient, reduces, and we check with the MRI scan, the size reduces. More than that, when we do the tumor surgeries and all, if the patient loses their senses, like vision loss, there will be, they could not able to see because the tumor may be compressed on optic chiasma, both the eyes cannot be able to see. There is a chance of hearing loss. Then they won't be able to move their hands. The nervous system will be more affected. Each nerves, the turn nerve will be affected according to the space. In such cases, they won't be able to get back the power of senses. But here, within 7 days, we get the treatment for when they fix for the surgery. That much time is more than enough for get rid of from that. Is one point. Another, the more happiest thing is we get the senses back. If your eyesight is lost because of the tumor, I could able to make it back. You will get the eyesight proper. Another, if it is not long duration, if it is 2 years, 1 year, it will be a problem. Otherwise, if it is recently happened, we could able to make it okay. Maybe the patient, according to the place, they may lose that hearing power. That also they will get it back. If I talk about the tumors, neurofibromatosis type 1, if the patient is with tumors, there is a chance of low eyesight and they may lose the eyesight because of the pressure. The brain will be get more pressurized, so there will be epilepsy, all that other headache, all this will be reversed. Even first, you just imagine if the patient with lot of pain, such patient, if the patient with acoustic schwannoma, if their ear is not, they are not able to hear that, the first day itself, the pain, they may be suffering a lot of pain, the pain will come down. That itself is happiest thing. No, that is the difference according to others and my treatment. Within the first day itself, the patient will be relieved from the symptoms. Within 7 days, the full senses will come back. Then if we go for the MRI, there will be improvement. The reduction of the size of the tumor. If we continue the treatment up to 21, we cannot see the tumor itself. Even in the surgery, if it is 3 or 4 centimeters, maybe 1.5. The remaining, there will be little bit portion, they will keep it there because the underlying nervous tissue get damaged. So that also a plus thing. Then we get such a fast result. There is no need of resting after 7 days, no need of resting. In the breast cancer, if we are talking about the breast cancer, the size of the lump comes down within 7 days itself. If it is first stage and second stage, according to the TNM classification, if the metastasis stage, if it is comes, even that also I could able to help them. But here what we have to think about is the main treatment for 7 days, even if it is only 1 day, the patient must be here for 7 hours. Sometimes the patient not be able to sit like that. I usually face the problem. Otherwise, if I could able to treat the patient continuously for 7 hours per day, for 21 days, even the metastatic stage cancer also will be in a control. Another point, if it is triple negative, if the breast cancer size reduced, I told PET scan, there is the SUV will come below 2. That means the metabolic activity of the cells come to, even if it is very calcified, it will become soft tissue. Within 1 or 2 days itself, it will become like that. Within 7 days, if it is only in one region, it will come down. We talk more about the breast cancer. If it is triple negative and all the receptors are not there, there is a high chance of recurrence if you remove that also. But here, the genetic level change you can expect. The patient, very rare chance of getting it back, a point to be considered and discussed here.
So at any stage of tumor, you can reverse it without any side effects, right?
Side effect. Some of the tumors are like cancerous, like glioblastoma. That and all I can control. That will be very fast spread all over brain and even other part of the body. There I face the problems, but we can control because within 1 year, 2 years, the patient go. They have to face a lot of issues. But if we take the treatment, if we are taking it little bit more duration, definitely there is result for even for that. I treated neurofibroma, vestibular adenoma, then neurofibromatosis, meningioma, all that I treated, glioblastoma, all that I treated, I got the result. In glioblastoma, we have to be little bit careful more. Like very fast, like 7 days, we get definitely the epilepsy will come down, the headaches will come down. When they speech, there will be stuttering, that and all will come down, but the spread, because it will be very big and it will spread to lot areas, that will take so much time to reduce the size, and up to we can control. Even if we control, I think I didn't get to cure the disease, I didn't get anybody, but I could able to control and he could able to leave that. If the patient come itself, they couldn't able to afford the treatment, no, sometimes they stop and go. Up to that, I could able to help them.